Hello everyone, I'm Debbie, and I would like to welcome you to Cancun. I have the pleasure of having two other participants that are actually in the group that have actually come over to Cancun with me and had procedures done. And I'm interviewing them now to see basically where we're at and how they appreciate and how they like this place. We're at One Destination Clinic in Cancun. If you have not been here, it is a phenomenal place. I highly recommend this. The technology and the doctors here are just way beyond anything that I've ever seen. And I've been doing this. I've been a patient for 5 years sitting in a seat, and before that I did 3 years of research before I got into a chair. If you don't know anything about my background, I am a retired mortgage underwriter. I can usually tell you your blood type by the time I'm in front of you. So I know what these doctors do. I know the background. I know the research. I've done everything for me personally to sit in the chair. So I'm going to go ahead and interview some of these people that have come here with me, and hopefully it will help you out in making the decision to come here. I'd like to introduce Michael.
Hi there.
And I would also like to introduce Mary.
Hi.
Michael is from California, and Mary is from South Carolina. Both of these are patients here now. Both of these have had work done in the chair now, and so have I. I can tell you Michael finished his procedure this morning. He had new arches put in. Michael, what do you think?
I'm still in shock, actually. It's been a journey, like anybody would tell you. And the level of care, sophisticated care, besides heart care, is quite remarkable. And this wasn't my first stop. I should preface this by saying that I have been to another clinic. No names. I'm not going to make anybody wrong. I'm not going to. That's in the past. What my experience is here has been from the moment of walking in the front door to nothing but literally tender care. Listening, communicating very clearly with the doctors who speak such perfect English, by the way, which I think is very helpful when you're communicating what you're trying to accomplish. Not only is the setting, I wish you could see what I'm looking at out here. Not only is the setting wonderful, the facilities are, you could be in New York City, you could be in San Francisco, you could be in Beverly Hills. And the result, the painless result, as separate from the original process of doing the implants, was I fell asleep in the chair. They didn't even had to wake me up once. I was so relaxed, I fell asleep. And when they bring the mirror over to you, you know what it's like. And I literally put my hand on my heart, and they handed me the mirror. And I looked at my mouth, and I said, oh God, hand me a Kleenex. Because at that moment, you see yourself again. You've got yourself again. And actually better, because I managed my expectations pretty well. But one of the things that I really would love to share is in a less than version of what I experienced here. When I went home, I literally had never been able to speak properly again. It was like my tongue had no place to go. I was lisping constantly. And from the moment they handed me the mirror and I sat up in that chair, I was able to speak with no.
As you can tell by listening to him, normally you have teeth in your mouth that are way too big for your mouth, and they don't, a dentist that really doesn't have a clue about what he's doing. And I've noticed this a lot in America, is that they're basically looking at the aesthetic version of the teeth and not really the cosmetic of the teeth. And they both go hand in hand. Here, they have a scanning wand that basically measures your whole mouth and makes sure that the teeth actually fit in your mouth.
Right.
If they don't fit, then you're going to be talking differently. And being with a lot of lisp, you're going to constantly be trying to get your tongue to fit. And as you can tell by looking at him and me listening to him, he just had these put in.
Within a half hour.
Within a half an hour ago, okay? It took us a half an hour to get used to the way he looks now because it's just amazing it's unbelievable how beautiful his teeth actually are. So, I mean, it took us, it was very emotional, but we got through it. So I'll let him finish, but I wanted to bring that up, that you have to have a dentist that's going to actually know the size of your mouth and don't try to overpower the mouth, because when you speak, you need to have both your top and bottom meeting, and you need to have both your top and bottom where you're actually seeing both the teeth when you talk. If that's not being done, then they didn't sign you properly, and you're not talking properly. So I'll let you continue.
A really important thing that a lot of people don't think about, certainly I didn't, you are not just a model, a subject, an inanimate mask of a human being. You have a personality, and your original teeth fit that personality, like your hair color, the eye color that you have. And to be able to actually communicate that with the doctors here and say, please don't rob me of my personality.
Right.
Where I brought pictures of what I looked like from the time I was in my mid-20s to the time I was, later on in my life. And, each of us has a unique smile, a unique personality in our smile. They're not perfect. They're not exact. That's kind of a part of our character. And this doctor, can I say his name? Dr. Fernando that I worked with. And he totally got it. Up to the slight tilt in my teeth, up to the fact that I smile a little bit broader on the left side. And I gotta tell you, it's absolutely magic. Because when you look in that mirror for the first time, you actually see yourself again the way you used to be. And better, quite frankly, because the teeth are quite beautiful. I can't wait to go look at them some more.
I can't wait to watch you eat them.
Well, yeah.
Let me tell you a little bit about Michael's experience and what has happened. And I'm seeing this a lot, and I've seen it a tremendous amount since I've been here and staying in the hotel that we're actually staying in, because most people do come over here for dental or even cosmetic surgeries. He originally came over here, what was it, a year ago? Did the all on four, top and bottom, had all extractions done and had the top and bottom done. He was put in temps and sent back home. Temps meaning dentures. And then he came back, what, 6 months ago? March. Okay, this is now September. In March, he had his new arches put in at the clinic that he was at before. And what happened?
Within the first 3 weeks, the first piece of the bottom arch began to break off. I don't know, maybe you don't want to see this, but I asked to keep these because I wanted to remember. This happened within a period of 3-4 months.
Can you see this?
I mean, that was the lower arch, and I had, all of a sudden, I had absolutely no molars. I could not chew again. They were sharp inside. I was cutting my tongue every time I tried to bite. It was quite painful and embarrassing because you open your mouth and you've got teeth right in the front, nothing in the back. Well, that's not something that a person expects when you just spent a year of your life
And the money.
And
And because he come from California, it's a 5-hour flight from California to Cancun. it's very expensive also to fly here. So in the last year, he's had to come here 3 times. The first arch was, maybe this is another thing that you need to be looking for, the first arch, permanent arch, was made with acrylic over a titanium bar. The ones that he has in his mouth now are zirconia, and they're grounded. If he talks, you can tell that he's not claiming. A lot of zirconias will claim, and I can't say this enough, you gotta be careful. Some dentists will put teeth in your mouth, and every single time that you're chopping your bottom meat, they sound like old people. It's like loose dentures in your mouth. It's not something you really want to live with. But as you can tell by listening to him talk, that was one of the first things I was listening for, was that claim. There's no claim in his mouth. Okay? And this doctor actually made sure of this. Now, yes, the old clinic said that they would fix his arches. Okay? They said they would fix them. But what happens is, let's say he comes over here and fixes it. That's an inferior product and it breaks in 3 weeks. What are they going to do to fix it and send it back home? How long is that arch going to last? Okay, these arches are supposed to last at least 10 to 15 years. Sometimes zirconia will last 30 years. It's according to what dentist is actually making these. So I'm going to tell you that if he went to the other clinic and he had these fixed, probably by the time he got home, they'd be broke again. So you want to make sure that you're working with not only a good dentist, but a lab that's going to make good quality products. And I can honestly tell you, I've seen the products here at ODC. They're superior. And I'm going to go in further a little bit about technology and what the technology is in this clinic. But the lab work in this clinic is second to none. They're not going to put out an inferior product. You're going to be assured. And here's the thing. This clinic is fixing other people in Cancun's mess. Okay? You have clinics here that all they want to do is take your money and get you out the door. Okay? Because you think it's cheap. Well, this particular clinic is not as expensive as the rest of them. Believe me, I've checked it. Okay? They're not near as expensive. So why would you want to go and pay the price of another clinic and have this clinic fix the mess? Yet you can start here at the best to begin with. It's a lot less pain and it's a lot less hassle. And whether you think so or not, you've got to pay to fly back and forth here at hotels and whatever. And most people work, so they can't even take off of work to do this. So that was important to him too. He's a real estate agent in California, and he didn't have the time to take off to get back here. So he was living with broken teeth. So I appreciate you, Michael, taking the time to come back over here and trusting me on this, knowing that my knowledge here.
Who wouldn't trust her?
Trust me, I'm not going to mislead anybody, and I will come back and tell you what messes, and I won't be honest with you. I know who's good and who ain't, okay? I know because I hear all these patients sending me pictures, sending me messages. I'm constantly having to save people in other clinics. Just listen to me. I know what, I'm not getting paid to do this, so come on. Listen to me. Mary, she had a full mouth makeover with crowns at another clinic. And about a month ago, she's a friend of mine. So I looked at her teeth and I said, Lord, girl, what's happened to the middle bottom down there? What's going on? But she spent a lot of money for this smile. Look at that smile, okay? She spent a lot of money for this one, okay? And I said, what's going on with that crown? She said, I don't know, Debbie. All right, now go ahead and tell me your story.
Well, I thought it was dead, and I thought, okay, well, I didn't have a root canal the last time 4 months ago, when they put the crown on. I thought, okay, well, maybe the tooth is dead inside, and that's why it's gray. It just got darker and darker as the weeks went on. So it was very disturbing to watch that, because with a mouthful of white teeth, you sure don't want a gray one in front. And so Debbie said she was coming back over here to finish up her teeth, and I said, okay, well, I'm coming too, to replace this crown. And she said, well, I'm checking out this new office, and I'm excited for you to come with me, and let's see. So the other dentist would have probably given me, you know, a new one based on the warranty that I filled out, but I felt like, you know, it shouldn't have happened to begin with. I'm ready to trust this new dentist as well. So I came over to this office, and I expected to pay twice as much based on the conversation that I had with the dentist. And when they got in and started looking at the x-rays and started looking at my teeth, they were like, oh, we can fix this with less pain, no root canal, and half as much money. So I was thrilled. The color matched up perfectly with the rest of my teeth, and I'm thrilled about it. So this is my new dentist as well.
Okay, now let me tell you a little bit, thank you, Mary, by the way. Let me tell you a little bit about me. Most of you know my situation. I've been dealing with another clinic for 5 years, and I was very loyal to that dentist. And last September, I woke up from a surgery, and from here to here was completely numb. I thought, well, maybe it's all the numbing cream, whatever, the numbing medicine, what have you. I went home, weeks later, I still was numb. I ended up talking to another dentist in America, and he said, come on up and let me see if I can fix it. So I went up there in Ohio, Dr. Graff, who's another one of my social media group experts. I do recommend him for implants. He pulled out moved the nerve, and then he placed 3 more implants, and the implants have turned out beautifully, beautifully. And I praise him for that. But as far as the teeth goes, I wanted to come back to ODC. I wanted to be a patient here because I've seen some of the stuff that they have done. I can tell you that my teeth, I've been going through 5 years. I've gone at least 2 to 3 times a year since 2019, and I've had at least 1 to 2 surgeries per time that I've been there, which was under general anesthesia, which has now affected my memory. If you don't do the right thing and go to the right dentist, this can happen to you. People ask me, well, Debbie, why did you decide to go back to Cancun? Well, I did research on this particular place, and I'm going to tell you that this dentist here, this facility here, is the technology here and the doctors here are way out. I can't even tell you. Listen, they are just beyond amazing, and it's hard for me to find American dentists that can even touch this place. I mean, this is unbelievable. Am I right? It's amazing. This week, they're going to put something in my mouth that a lot of dentists in America don't even do. It's called peak teeth. It is an arch that literally has little, and I'll put a video up of this, but it has little pegs, and they actually put crowns on each one of the little pegs. So it looks like in my mouth I have all crowns and no arches. I have all on 4, top and bottom. I'm sorry, all on 4 on top, all on 5 on the bottom. I have 5 implants on the bottom. And so we've been doing the try-in this week, and hopefully Monday I will have my new teeth. After 5 years, I will finally be having permanent teeth in my mouth. Now, I'm going to tell you, I'm probably going to get very emotional about this because this is really big for me coming in here. And this clinic has been nothing but fantastic.
Can I throw something in?
Yes.
Okay, and you can
Yes.
use the H word,
Yes.
help,
Yes.
because I know you've been through help.
Yes, I have.
I mean,
Y'all haven't seen pictures of what I've gone through.
I have, and I mean, you don't want to see them. It's painful to imagine what this woman has gone through.
Happening by your side.
Yeah.
And the expectations that the person has when they even think about engaging in this process. And I hope that part of this work that we're doing, this interviewing right now, includes a very specific walk through the facility,
It will.
and perhaps even having the dentist, the doctor show you the techniques that they use. It's the difference between a small, old Chinese or Japanese car that is very, very basic, and a finely crafted, handcrafted German
Rolls Royce, we were talking about last night.
Rolls Royce.
Yeah.
I mean, when you see the chair that you sit in, the chair that you sit in here is the $350,000 chair. It is ergonomically built to support your body, because you will spend hours in the chair.
Yeah.
And you know, you're gonna have at times 2 or 3 people hanging over you, and the lighting in the ceiling above you is not the typical that you see that's blaring in your eyes to the point that you want to wear sunglasses. That is so important to know that the technology is not just cutting edge for now, that as they're working on you, you know that they are already moving forward.
Exactly.
So they are ahead of the curve and providing, because what they are dedicated to doing is giving you the absolute best, most up-to-date technology so that you have the best experience, because their philosophy here, as I see it, is don't say how good we are, we show you how good we are.
Exactly.
And there's a huge difference in that, and it gives you a feeling of trust and security. You feel safe here.
Right. And another thing that I can honestly say, when we walked in, we had to ask them when they were going to take our money. They never once came at us at all for money. You go into any clinic in Cancun, and I can tell you, it's not even 5 minutes, honey. You sit down, before you even start signing the papers, they want your money, okay? I was here 2 days. When do you want your money? Okay? This one right here, same too. Okay. Oh, and you know, their prices. I've been doing this a long time. I've been doing this a long time. You're not going to beat their prices. I'm sorry, you're just not going to do it. There's just absolutely no way.
And it's not cut rate service.
No, it's not. And I'm going to tell you, anybody that's doing research on implants, okay, they use Straumann implants, okay? Straumann implants. They use zirconia teeth. They use peak teeth. If you don't know what these are, research, because this makes a huge difference in what you're going to end up. Because the implants are important, and they're, oh, and by the way, nowhere, this was the main reason I came to this clinic. When their advisor said, Debbie, we do not do any surgeries in this clinic. And I'm like, what? No, this clinic, and I'm going to show you a video, is right next door to a big hospital. They do their surgeries in the hospital, all right? If you're coming from America or any other country from that matter, and you're coming to a foreign country and they're sedating you, wouldn't you feel more comfortable being in a hospital where if something happened, they can take care of you? Michael has heart issues, okay? That would have been huge for him. Even though we didn't get his implants here, that would have been huge for him.
It would have been huge.
It would have got me in a heartbeat. I'm going to tell you, I kicked myself for not having to come here for my original implants back in 2009.
When I heard that,
But they weren't here.
they didn't. But imagine going to your old-fashioned dentist in that office with windows all around, with people bustling around, and an anesthesiologist comes in, and right while you're in that chair, he sedates you the same as they would do if they were doing open heart surgery.
Yes.
And you don't actually know who did your surgery.
Exactly.
Because it wasn't the person who thought was.
I can tell you that most of mine were done by students. They were not done by the person that told me that they were actually doing my surgery.
I want to know, I want to meet the person who's doing my work.
Exactly.
And feel confident.
I'm telling you, I'm reading something on the wall behind Michael's head right now. It says beauty is in the details. That is so true. But so is safety. So is credentials. I cannot say enough about this place. I really cannot. And I'm gonna say it over and over and over again. This is the place that you want to come and you want to do tourism. Because when you walk through the doors here, which I will show you videos, when you walk through, you know you're in a good place. You know you're in a good place. And I am so thankful. And I believe truly with everything I have that God put me in this, put me through what I have been through so that I can end up here. And I can't thank you enough. Thank you both. This clinic deserves this. And this is, I mean, we will make sure. Together. We're together. Thank you.
Thank you.
Thank you for taking the time to listen. I hope that you do the same as we did. Thank you.
Thank you.